Hi folks, thank you for joining this channel. You're quite welcome to make some comments. Today, I'm going to tell you my personal story. How about that, folks? How did I form a company named Dollar Care, or so-called Foremost Foundation, doing business under the umbrella of Dollar Care? I'm a runner. I've been a runner, and I have a family history of osteoarthritis. And I have unstable knees. So I've seen orthopedic doctors, and they suggested about 20 years ago that I need to have arthroscopy. Being a healthcare professional, I took charge upon myself. Then I kept on running. I didn't stop. I did not stop. I used to run 6 miles every day, 5 o'clock in the morning, and participated in several marathons in Los Angeles and Huntington Beach. I'm proud of myself, taking charge of myself. Then after several years, one day I was on a treadmill for an hour and a half, 2 hours. I had little discomfort in the chest, which is unusual. I asked my son, hey, what should I do? He said, Dad, it's easy. Instead of doing a CT angiogram, we'll just go and do an angiogram through one of the radial arteries from your arm. So it turned out to be simple. I said, okay. So I agreed for it, went and had the procedure done. Everything went well, folks. Everything went well. I was happy with the service. I was quite pleased with healthcare professionals. There is nothing wrong. And I was discharged next day. Within 23 hours, I was discharged. And I had obviously, there was a little narrowing, so I had to place a stent. And next day, after the discharge, I was doing fine. 10 days later, this is the beauty. 10 days later, I received a bill. Yes, surprise medical bill. You wouldn't believe it, folks. You probably think you must have received a bill for 30, 40,000. Yeah, that would have been, that's not bad. Even that is high. But I received a bill from the hospital, $227,000, folks. $227,000. That shocked me. That shocked me. That literally pissed me off. I said, I need to do something, man. Now I'm retired. I need to do something. I had to. I had to. Being in the healthcare for 40 years, I had no choice. I took charge upon myself. I have a non-profit company called Foremost Organization. We give lots of scholarships to the vocational scholarships in the local community colleges. Mine is a very small non-profit. Don't take me wrong. I don't have millions to contribute to the non-profit. Well, I started as a small non-profit. Ultimately, my goal has been healthcare. Being in the healthcare, I said I should do some good. That bill I could never forget. Medicare paid $35,000. Can you imagine, folks? Medicare paid $35,000, and my supplemental. So they must have colored over $50,000 to $60,000. This is where our healthcare is, folks. We need to take charge. This has been my lifetime goal. Before I die, I want to make sure every American is insured properly, take care of their own health, take charge, and shop around for health care. Yes, with brand new concept called dollar care or cash care. You name it, folks. Or Google MD Live. Microsoft MD Live, Alexa MD Live, Facebook MD Live. You Google those names, you will go to the Dollar Care Foundation. Under the Dollar Care, if you go to the service section, there's also telehealth, which I'm trying to start a telehealth program under the nonprofit umbrella. But main thing is under the service section, you can see an HSA application. As long as you have a deductible health plan, whatever you are, if you are a self-employed, you're working for a small business, large business, go to the human resource, find out what kind of health insurance. If they're not providing you health insurance, get one. If you're healthy, you don't see a doctor, you come under the category of well category. Your premium should not be more than $100, folks. I'm not kidding. Deductible health plan, whatever you can afford, 1,000, 2,000, 3,000 deductible, lower your health insurance. Premium, that's the primary goal. Lower your premium. Don't spend more than $100 on your health insurance. Money you save from that, put it to the HSA Bank. There is an application for HSA Bank. Fill up that application and contribute. Individuals can contribute $300 a month, $3,600 a year. Families, $600 a month, $70 to $100 a year, which goes a long way, folks. I'm not kidding. It goes a long way. In 10 years, it'll become $36,000. And for a family, it'll $72,000. The beauty is that is tied to your brokerage account that grows. As long as you're in an index fund, you're not taking heavy risks. Average growth is 15-20%, and that 36,000 will become about 60,000. 72,000 will become over 120, over 100,000. This is where you get your debit card. You don't need to use your debit card, but if you want to pay through your HSA, fine. But I would rather personally pay cash, get all the receipts. The other day I had a neck x-ray. They could have given me the bill right and right there. I could have paid it. But no. You know what the practice is? In the back end, they rip your insurance companies. This has been an ongoing saga for healthcare because on the back end, they rip your insurance. This is where the Dollar Care comes up. So anytime I check into the hospital or for any procedure, CAT scan, angiogram, very first thing they ask you, do you have insurance? I said, I do, but I don't have it with me right now. But how much is it anyway? So are you paying cash? I'll try if I can. Why not? I said, it's going to cost you $2,000. This is an example, $2,000. Well, I don't know if I can afford $2,000. Maybe I'll pay $500. How about that? You know what? You will get that, whatever the testing it is, for whatever you are, because you're giving cash. Yes, you're giving cash. There's no billing involved. They don't have to spend anything on their billing. So you can get your testing done for whatever you can afford. Once it is done, collect the receipts. Keep on collecting receipts, what you pay for over 10 years. If it reaches around 10, 15 grand, pull the money out of the HSA, health savings account, tax-free, go and buy a new car. How about that, folks? This is the beauty about deductible health plan with health savings. I advise everyone to have it. Folks out there who are self-employed, they think they're wasting their money. They don't know what they're talking about. They're not wasting money by having a health insurance. You're losing money by not having insurance. Yes, you're losing money by not getting a deductible health policy and putting money aside into health savings, which you come out ahead. People out there, when they don't want to buy health insurance because they're wasting, you're wrong. You're wrong. You can make money on your health insurance. Yes, you can save money on health insurance. How about that? Folks, follow me. That's all I have left. This is my lifetime passion for everyone to have health savings accounts with a deductible health plans. I would like you guys to make comments, positive, negative. As a matter of fact, I love critical comments. Yes, if I doesn't bother me, but what I am doing is the right thing for everyone. When you have a public-private partnership, under the umbrella of public-private partnership, I want to take care of the folks out there who have nothing. They can be given a certificate of guaranteed coverage under the Health Review Authority, which is under the public-private partnerships. People will get certificate of guaranteed coverage for people who are impaired economically or physically. And that is better than your Medicaid card. What they issue, Medicaid is useless, man. Nobody takes it. Once you get a certificate of guarantee, you can go to any doctor, you can go to any hospital, you can get the best care for ordinary folks out there. That's the beauty. Thank you, guys. I love you. I love you. I would like you guys to follow me and check me out, consumersdoctor.com. Invite me as a public speaker. I'm ready to educate people, companies, small or large. It doesn't matter. It doesn't matter. Thanks again. Goodbye. God bless.